thank you so much, Ewan, and it's absolutely brilliant that you're here today. And how lucky are we actually as a region that we've got an ICS, ICB, ICP, whatever bits you want to say, that gets it. Please don't assume what's happening here in the North East is happening elsewhere in the country, because it isn't. And I think that is due to the testimony of each and every one of you in the room who absolutely knows why addressing smoking is still a really important thing to do. And I think today is going to be a hugely important day to celebrate the fantastic progress you have been making. But in the North East, we always know we're good, but we can do even better. And sometimes I think, we can be a bit harsh on ourselves, but I do think this sense of challenge, and if we really are going to truly end smoking, there are certain things that we're going to have to do differently in all of this. So, but I think for today, you should be really, really, really proud of the huge, important progress that has been made. So my pitch brief was to think about how are we working towards a smoke-free future, and just a sense of what does a future look like, and some of the steps along the way. I'm going to be really careful I don't pinch half of what Joanna's going to say, and the most important person in the room follows me really next, which is the amazing Sue. But I did just want to talk about it from a bit of a costs point of view as well. And I know costs is hugely important, isn't it, at the minute? Every day it's have we got the money for things? How much are things costing us? And what I did just want to flag to you all is, wherever you are in the region, you can work out exactly how much is smoking costing your local authority, your trust, the ICB, and basically it costs a heck of a lot of money. It costs a huge amount of money, and this is a bit busy to see it, but this is the Ash Ready Reckoner. And if you do want local data which looks at the impact on healthcare costs, really importantly social care costs, so how much it costs, sadly, when we have to look after somebody at home who might have COPD or they've suffered from a stroke. It also looks at fire costs, so the single greatest cause of domestic fires is still discarded cigarettes and lighting material and things as well. But actually, the bit that doesn't get a lot of the attention is the place that bears the biggest burden negatively of smoking is productivity, it's workplaces. So we all think about how much it costs the NHS to try to treat tobacco-related illness, but it's our businesses that struggle the most by people having to retire early, they're absent because of ill health, smoking breaks, etc., etc. And I do think, we're striving as Fresh to make more of this economic argument, but it is also really worth bearing that in mind, particularly who are the biggest two employers in the region, NHS and local authorities. So actually, the more we can do to also support our own workforce to stop smoking, the better. So that's costs. But actually, it's about our loved ones, isn't it? And the reason why you're all here, the reason why I think you all applied to do the most important jobs of all, which is to support smokers to stop, is because we don't want our relatives to end up on this ever-increasing collage of photographs of our loved ones. And, this is the biggest killer still. And it's actually 26% of all deaths since 1971 have been purely down to the most perfectly formed weapon of mass destruction, which is the cigarette, isn't it? This is why these people have died, and this is why this is my dad here. And I know many of you have seen this slide before, but that's my dad. He was 61 when he died of COPD. There is nothing worse than seeing your own father slowly suffocate to death for the last 2 years of their life. And I think in the North East, there won't be one family that doesn't have somebody they could sadly put onto this slide. So this is why and these are all completely preventable as well. This is the big point here. So that brings us back to what are we doing right now to prevent some of these deaths and some of our loved ones dying in this way? And I do just want to really now flag to you, this is about working with our communities, working with our loved ones. This is not about stats, it's not about percentages. This is about the voice of the North East, and this is about really showing that we've had enough and that we don't want more of these, our loved ones, ending up on that slide. So this is the role of you all to please continue to find people who want to share their stories. We're absolutely thrilled that we've got Sue Mountain with us here today, who single-handedly has acted as a huge inspiration for so many across the region to quit. And because of that, many of the people are now coming forward. So we are currently now, and huge credit to Neil and Andy, running a new Fresh TV advert, which is the story of Debbie and Sadie. And a huge thanks to them. Debbie contacted us on Facebook, says, "Do you remember me?" Of course we remembered her. So this is their story.
Just watching somebody there gasping for breath. It's not very nice to watch, and you feel so helpless because you can't help them. In his prime, he was a fitness instructor. He always smoked. When he was in his 30s, he was starting to struggle to breathe. And he started to find he couldn't do the things he loved.
I've never knew my dad to be fit and well. I can only remember him being on oxygen and in a wheelchair. But obviously we've seen a lot of dark times, saying our prayers at home, hoping that he'd survive this hospital trip. Now looking back on that night, I think he was asking for my permission to let himself go.
He used to say, "Oh, God, if I could only have my time back, I would never have smoked."
Stop smoking now. Do it for your family, not just for you.
Put smoking behind you. Get help to quit at freshquit.co.uk.
So hopefully you'll have all seen that. It's on TV right now. We're on radio. We've got materials and everything. And you might think, gosh, that's so bleak. But actually, we know from the huge amount of insight that people who smoke will underestimate the risk. They think it won't happen to them. This makes it real. But what we absolutely want to do is say there is plenty of support out there to quit, whether you're in hospital, through our brilliant local stop smoking services. And it's also around having that consistency of message as well. So this is why you will see a lot of and Andy's going to cover this in a workshop this afternoon, the importance of being really clear with messaging, and we're driving, traffic in terms to a regional fantastic portal now with the Fresh Quit website. And the response to this, genuinely, hand on heart, because we're on Facebook and we track. I'm often awake in the middle of the night and I'll be chatting to people. I haven't seen one negative comment. I have seen so many people saying, "Oh my gosh, I remember Denham," or "Wow, Debbie, Sadie, how brave are you?" And people tag each other as well. And the power of this is where social media actually is really, really positive. So please do get behind campaigns like this, because it really helps you out, whether you're working in an NHS trust or in the local authority or elsewhere. So it is about telling stories, and it's about a whole myriad of different people who have come forward, who have shared their stories. And for us, it's about building up. It could happen to lots of different people, but really importantly, it's never too late to quit. You're never too old to quit. It can be very tricky to quit. You might have to try a number of times, etc. So these are just some of the examples on that. So in terms of what we need to do, we're really lucky, aren't we? Because in terms of public health, there is a very clear evidence base about what we need to do in terms of reducing smoking. In fact, this goes back to 1962, the Royal College of Physicians report, which had a number of different policies that they were arguing for all that time ago. We should be really pleased that as a region, we've really recognised the role of a locally together approach by having a regional tobacco control programme, which is the only one that has existed this long. We've been running, Fresh launched in 2005, and that has been a really consistent glue that's held so many things together during various reorganisations and peaks and troughs and different tobacco plans and different governments. Fresh is really, really proud to have been the glue to hold a lot of things together. I've never called us a bit of glue before, but there you go. And it is about the importance of that international to local level. It's 5 major tobacco companies, essentially, are the people that have caused the 8 million deaths since 1971. And it has recognised that it's really important that this is about social norms, it's about a social movement, it's about population level working. And really importantly, it's about the very important work that there is to support individuals to quit. But if we'd simply just targeted individuals back in the day and, you know, the fantastic role of stop smoking services, but they're not there designed to drive down prevalence as such, we need to do lots of different things together. So it's been about and needs to continue to be about shifting societal norms. So the importance of making tobacco use less attractive, affordable, accessible. There isn't one single solution. You need to do lots of different things. But we've been very evidence-led, and we do not apologise for why we've stuck with a very clear evidence-based 8 key strands approach for the last 20 years. This has been really important to do this because it's superseded lots of different tobacco plans and things, but all of the tobacco plans that have been published in this time, they can all fit under this. But this is very evidence-based. It's building infrastructure skills and capacity. This is about things like today. It's the advocacy for evidence-based policy. It's the support. It's reducing exposure to secondhand smoke. It's the year-round media comms, communications. It's the really vital role around supporting smokers to stop and stay stopped. It's about the raising the price and the reducing the illicit trade. It's about the right kind of tobacco and nicotine regulation and ensuring that we really regulate the most lethal products out there and get the right balance around other products and things as well. And it's about continuing to track the data, the research, the public opinion. And what has been really important is being able to be flexible and to be adaptable. But I did just want to flag this. So if you're not involved in a local tobacco alliance, we would really love you to be so. They're led by your local authority, and the NHS role in there is incredibly important. And that level of partnership and collaboration and you know, all testament to the fantastic leadership of the North East local authorities and the ICB that has, you know, absolutely recognised the importance of this approach. So what progress has there been? So it's a bit busy, but essentially we've gone from having 29% of adults in the North East regularly smoking back in 2005. We're now down to 11%. So that is phenomenal progress overall. And also if you think about some of the key deprivation groups, the key areas where there has been much higher smoking rates, this is routine and manual smokers. This is been the largest pool of smokers. And for both adults and R&M smokers around the pandemic, you know, we all know the impact the pandemic had on our region, inequalities and the level of stress and mental health distress, etc. So there was a spike up. But you'll see now in the last couple of years in particular, we've made, you know, really significant progress. So this is phenomenal. And there's not one single thing that's done this. It's everybody being really clear and focused together. So this is brilliant. And this is actually, if we look across all of England, the North East has had by far and large the biggest drop in smoking of any region in England. In fact, it's down 62%. So we could never really have quite imagined that. Now, that's the good news. You will also all know that smoking rates are much higher in particular groups, most deprived, people with serious mental illness, those who are experienced homelessness, those who are experienced drug and alcohol addiction and things. And last week, we were in a meeting with the Chief Medical Officer, Professor Chris Whitty, who absolutely was clear, do not get complacent. He was very clear. He said the next 15 years are going to be the hardest ever. He said, we all need to double down our efforts. If anybody thinks the time has now come to step back and say smoking doesn't need to continue to be the focus, or it'll just somehow miraculously, organically go down, you're absolutely deluded. So he was really, really clear about that. And I think this is where the really now focusing of you on the ground in localities, working with your local authority partners in terms of, you know, really targeting some of the key groups that have got higher smoking rates and, you know, that sense of bespoke support as well. So a one-size-fits-all isn't going to necessarily be the thing that is really going to help. But he was really clear and, you know, he actually gave a shout out to the North East and the consistent leadership and everybody working together. So I did just want to say, great news, well done, but... So we're lucky, we've got a very clear vision for our region. No other region has got this clear vision. We're very clear. We are ultimately saying we're going to have a smoke-free future, free of the death and disease from tobacco. And I think if you're stuck in a lift with anybody, the thing I want everybody to be able to say is a smoke-free future, free of the death and disease from tobacco, is needed, wanted and workable. This would improve the health and wealth of our region's most disadvantaged communities more than any other measure. Blah, blah, blah. So there you go. That's signed off by all the directors of public health, the ICS Fresh. This is you, some of you in the room today, a couple of weeks ago. We went out and about the region. Every local authority and NHS trust came together, held up the banner, so there should be no hesitancy. There is nothing controversial in that declaration that would mean you couldn't feel comfortable with it. It is ultimately saying, yes, Rachel, I'm going to shut up. We have to strive to basically an end to smoking. And how we're going to do it is really clear. We're going to be advocating on a consistent approach. We know our recipe. We know what we're asking for. We know it can work, and this is what I wanted to just flag here is, these are all of the different bits of regulations covered in the last 20 years. Despite tobacco industry efforts, this in the middle is youth smoking. Now, we haven't gone out and targeted kids in schools because that doesn't work. What we've done is we've changed the adult world. But don't assume that that won't go back up unless we keep our foot on the gas. Now, Tobacco and Vapes Bill, you might be aware there was one last year, then there was a change of government, there needs to be a new one. All I will say to you is, it's now delayed. We are concerned about the delay. So on Monday, we are in London, we're at a parliamentary event. Sue's coming with me, as is Debbie and Sadie, as is Cathy Hunt, and we will be saying to the new minister, crack on with this bill. We also need to say that whatever is in the next version of the bill, we're going to take our time and we're going to double check this is as evidence-based as we need it to be in terms of health and equalities. But we're here to support you. We will need the North East to have a say like I had last year to make sure that we get what is needed. The bill is not the end to smoking. It's an important milestone, but there's still plenty of other things to be done. And what about the public? Are they behind us? They absolutely are. You will know when you're talking to that person who's just been diagnosed with lung cancer or COPD, the regret, the wish they'd never started, the wish they hadn't got addicted, they don't want their own kids to fall into the same trap. We need to be really confident this is the right thing to do. And we haven't got time for the little film, but it was just basically the public saying, I absolutely want a smoke-free future. So I really hope in 15 years' time, we're in this room and we've said we've done it, and that's it. And smoking should and will become a thing of the past. And if anybody can do it, it's the people in the room today. So thank you. And this is the team. Thank you. But you're all the team.